welcome. This is Health Check on the last day of June. Look at you making it through an entire half the year of 2020. And it's exciting because we do have great conversations right here on set. Today we have a podiatrist, I hope I said it correct, I've been practicing, and a chiropractor. Also, podiatrist come because these two have a great relation and we'll be learning that. Also, my best highlight is it's an all ladies show in studio, so welcome ladies. Karibuni sana.
Thank you.
This is Health Check on Hope TV. Remember, you can share the video. It is live on your Facebook, so go to your Facebook if you want someone to watch it, and you can also go to YouTube. We are live out there. Just go ahead, share it, and everyone will get to learn together. With me, we'll start with Dr. Margaret. Please introduce yourself, what you do and where you do it.
All right. I'm Dr. Margaret Stower. I'm a chiropractor and also a physical therapist. I run 2 clinics, one in Polycare, Lavington Center. We're just above the Barclays Bank, what is now ABSA, and that is off James Gishuru Road. The other clinic is in Nyari South, Bishop's Gate, off Ngecha Road.
Okay. Thank you so much. That's a brief introduction, but it's tight. People will be asking, chiropractor, what do you do? Exactly. You will break that down for us.
Chiropractors are very important, and I'm so happy that today we are talking about the spine, because the first thing that happens when you are born, you develop the spinal cord, and the spinal cord is a series of nerves that are protected by the vertebral column, which is the spine of the body. So chiropractors are really trained to analyze the spine and see areas that are misaligned, and then they correct the misalignment.
Absolutely.
So it's very important for us to look after our spine because it's a very important structure of the body.
Absolutely. I mean, that's one of the biggest complaints from people. They're feeling pain and, all that. So here's your doctor. She is in studio. And get ready to ask all the questions you might have and learn as much as you can. And with us also is Sally Kariuki, who is a podiatrist. Karibu sana.
Thank you very much.
Where do you serve and what is podiatry in general?
Okay, as you heard, my name is Sally Kariuki. I am a podiatrist, and this means I deal with the lower leg, and this with a bias on the foot and the ankle, and we sometimes touch on the knee. I am based on Ngong Road, Paresia Center, which is next to Good Shepherd Church.
Okay. Can we talk about the relation, why we have both of you here? Because there's a huge correlation between the feet and the spine.
Right. Now, if you look at the spine and the feet, it's part of the same anatomy.
Yes.
The spine is connected to the feet.
Okay.
So what the feet do, they will affect the spine. And what happens in the spine will affect the feet. So you'll find a lot of, I work a lot with chiropractors, Dr. Stower here. So I'm always referring patients, back and forth to refer patients, because if I want my treatment to work well, then, and I don't involve the chiropractor, then it's not going to work, and vice versa as well. So we do have a very good working relationship with chiropractors as podiatrists.
Does she refer people to you?
Yes, she does.
Yes, I do.
It's a good partnership.
Yes, because the foundation of the human spine is really the feet. So it's very important for us to be able to work together as a team.
What are some of those symptoms that someone might be having when their spine has an issue?
Most of the time, the best and the only symptom is normally pain.
Yes.
Most people come to you because they are in pain, but you'll find that there are other symptoms like restricted movements in an area and headaches, and most of the time it's really pain and restriction.
Okay.
So that's what brings patients in the door, and which is a concept that we have to change, because I know Kenyans really look and come to the doctors when they're in pain. They don't come when they're well.
Yes.
And this is where we need to talk and have the conversation that really you don't have to wait for your pain in order to go and see either your chiropractor or your medical doctor or your podiatrist,
I'd love to agree with you, Dr. Margaret, because just get checked and make sure everything is okay.
It's okay.
It's okay to just walk in for consultation.
She
won't turn you away. She'll be like, you're not feeling pain, go home. No, she will see you, right?
And advice.
And advice on what you can do better.
Right.
Absolutely. For foot care and foot health, what are some of the things when people walk into your office or come to see you? What are some of the symptoms they are presenting?
Well, that's a very loaded question. When it comes to feet, there's so many problems that do exist. But the same, with a lot of people with foot, when it comes to foot health, by the time you come in with pain, you've had the problem for a while. So mostly we advise people come in for a foot checkup early, then let us pick up the problems and we'll start the treatment. When you wait until you're in a lot of pain, then you come in. Believe me, that whatever problem you have is well advanced. But there's a lot going on in the feet. Every part of the foot does have a problem. There's problems with the nails, like ingrown toenails. There's going to be thickened nails. There's going to be fungal nails. There's going to be toes that are bent. There's going to be corns. There's going to be calluses. There's going to be verrucas. There's going to be wounds. There's going to be heel pain. There's going to be ankle pain. So there's going to be skin diseases. So it's quite a lot going on there.
It's quite a lot.
Yes.
Okay, fine. But she will sort you out every single issue with your foot. Just go in before it gets too bad. Causes of spinal pain, injury, poor spinal health. What are some of the causes?
Right. The major cause is what we do, how we do, what we do. It's really ergonomics at your workplace, at your home, at play. How are you doing what you're doing? Because really the body is really built for health.
Yes.
It's not built for ill health. But we as human beings tend to involve in certain things that may bring ill health to us. When I think about the Bible and how Psalms 139 verse 14 says, you're wonderfully and fearfully made.
Wow.
So really we need to respect our bodies and make sure that we are doing the correct thing and taking advice when we can.
Absolutely. We've talked about symptoms of foot pain. Someone can come with an injury. Someone can come with something else. But are there any false signs that people come in with thinking the issue is the foot, but yet it's the back? What are some of the issues surrounding that?
Yeah, that's a good question. And thank you very much for that, because when people obviously develop foot problems, I'll be the first point of contact. And they'll come in and, they'll say, oh, I'm having this kind of pain. And I'll look locally, the feet, the ankle, the knee, and I can't find anything that's going on there. So I'll start thinking about the back. So when people come in with especially problems where they're having burning pain in the feet, some numbness, pins and needles. Of course, there's some diseases that do this sort of things. Yeah, there are things like diabetes, rheumatoid arthritis, heavy metal poisonings and things like that can cause those problems. But most of the times you'll find that there's probably something going on in the back. There's a back injury, there's a nerve compression or something like that that will then bring symptoms in the feet. So when I examine the patient and I cannot find a local cause for this, I will then tell the patient, go to doctor, and let her look, and she'll probably find something there.
Is there an issue on the reverse?
Yes, there is. There is an issue on the reverse, because sometimes you get someone coming in with a spinal misalignment, and yet really it's a shortened leg, which needs Dr. Sally Kariuki, the podiatrist, to actually look at and see if they need to put a raise in it, and I'm sure she'll be able to tell you more of what it is. So it could be the reverse. You could align, and if there's a shortening somewhere else, then of course it just needs to be measured out and corrected.
So that's one of the things.
Yeah, that's the relationship and the correlation where we could actually work across each other.
Let's now talk about spine alignment.
Let's talk about
what is spine alignment and how should it align? How can I be able to see it when I look at a mirror?
Let me start off by talking about the natural curves of the spine. If you could look at the vertebra, we have three natural curves in the spine. There's a curve in the neck, which should go like a C. There's a curve in the thorax, which goes opposite, like the upper back. And then there's a low back curve, which goes that way, a low back curve. So occasionally, because of pain and because of tightness in the muscles, you tend to lose those curves, and you need to get them readjusted, what we call an alignment, to get your back into the right curves. So these are natural curves that you are formed with, and anything out of the norm will cause pressure and will cause nerve pain. And one of the things about the vertebral column is the discs in between the vertebral column. We have several discs in each column, and those discs really shock absorb, just like the discs and the car. The body is really mechanical, so it really absorbs the shock. of the body. And sometimes because of the pressures that we may exert on ourselves, we get a disc that is a little bit out, and depending on how it could be herniated. We call it in the medical terms as a herniation and a bulge. There's some cases that may not be helped by chiropractic and they will need surgical intervention. But then some cases that are very simple and can be adjusted, and you get your pain relief. The most important thing is to actually get some spinal imaging so that you get real radiographs where you can see and know exactly which case can be handled by which physician and which doctor, so that when you come to us, you really know what it is that you have to do.
Okay.
So an alignment is really to recreate the curvature that we have in our spine.
This curvature that we have, and I'm coming back to Sally Kariuki, what do the shoes we wear and things we do have to affect with the, the alignment of?
So as I said earlier, the connection between the feet and the spine is that the skeleton is connected. So whatever is happening in the feet may affect the back.
Okay.
So if you come in and put on let's say put on the wrong kind of shoe.
Okay.
And we're talking about like really high shoes.
Okay.
I'm not sure you've seen that.
So maybe 6 inches. Is that high?
If you'll allow me.
Yes, please, go ahead. Do it. Oh, let me get it. Hey. Ooh, fancy.
So we have this shoe, which it's a very fancy shoe.
It is.
And people love these shoes. They look good and they make you feel very confident.
Right.
But if you wear this shoe on a regular basis, it may eventually affect your back. Because what it does, it's going to compress the spine, the lower spine, isn't it?
Yes.
Yeah, it's going to cause, because this is not your natural posture.
Yes.
You are not born
Like
to stand like that. Yeah.
Okay.
So it compresses the lower back. Once it compresses the lower back, then what happens? The nerves and discs, cause problems.
Okay.
Yeah.
Okay.
Yeah. So there is a connection there, a very big one.
Then what shoes are we supposed to wear? Because this is a really long conversation. Some people are like, oh, high shoes help you with posture, and flat shoes are bad.
Okay, good. Now, if I say, people are going to kill me if I start saying, do not wear high heels.
Say it. If you need to say it, here we are being real. Say it. If we need to stop.
Okay. What I say, this is what I say.
Yes.
And any shoe that is 2 inches or higher will most likely affect your back.
Okay.
Yes.
So try not to wear it on a regular basis. You may wear it for a few hours, let's say, to a party where you're not going to stand
Show
a
up.
lot. Yeah. Show up in the shoe and then, sit down, look good. But if you're going to walk for distances, if you're going to stand for long, do not get used to wearing high heels.
Okay.
They will affect you and you will suffer. Yeah. So what are the good shoes? What are we talking about when we talk about good shoes? Then people say, if you can't wear high shoes, then I should wear flat shoes. Flat shoes are not good for you either.
Wow.
Yeah.
Okay.
Very
That's
flat shoes
true.
are not good for you because they don't give you any support. Because we're not used to walking barefoot. I
That's
think
true.
we have evolved now.
Yes.
We're not used to walking barefoot.
So those guys
yeah?
were luckier.
Yeah, their feet, they strengthened in that position,
Okay.
and that's fine. But for me, you, her, our feet have evolved now. If we wear very flat shoes, we will get problems. Yeah, we'll start getting things like heel pain and stuff like that.
Yeah.
Or knee pains. So what we should wear is what we call supported shoes.
Okay.
Okay.
Do you have
And
an
again,
example?
I have an example.
Please show us what. Which one? This one?
The black one. The black one.
Okay, this one. Okay.
That
Ooh.
So if you look at that shoe, which a lot of people say, you want me to wear my grandmother's shoes?
I know, granny shoes.
This is an example
Uh-huh.
of a comfort shoe. If you look at it, if you look at the side profile,
Yes.
you will see the curve
Yes.
there. And what this curve does is that it supports the feet. So the feet don't move around too much. They don't play around too much. Then the shoe is nice and soft on the inside, so it's not going to injure the heel or
Okay.
anything like that, any of the bony structures. It's deep as well, so it's going to accommodate your feet, even if they swell, and your toes if they are bent. It's folded at the back here, so it's not going to injure the back of your heel. And it has a rubber sole. Because when we walk, there's a shock that is produced.
Yes.
And if you're wearing some hard heels, the shock goes through to your bones. But if it's a rubber sole, the shock is dissipated in that, yeah?
Okay.
So that is an example of a good shoe. It may not be the most beautiful shoe, but it's
Absolutely.
comfortable. So for every day running around for work, do wear comfort shoes. If you're going maybe to a wedding, fine, wear your very fancy shoes, but just for short
Yes.
periods. This shoe is not a shoe for every day. If you continuously wear this, me and Dr. Stower will be your best friends.
Wow.
You will make us rich if you keep on wearing that
Okay.
shoe. Yeah?
Okay.
Yeah.
Is this one of the things you do? Like, can I come for like shoe training? I'm not joking because it's
No,
important.
yes. No,
No one ever says this to us.
No, it is very important. And I can tell you, like, half the women who walk into my clinic,
Right.
it's a shoe problem.
It's normally
nothing else.
shoes.
Yes, and I'm sure you've seen the same.
I've seen
it's
the
a
same.
shoe problem.
Okay. And
Yeah.
for men?
Men as well. Men not as bad as women because
Okay.
men's shoes tend to be a bit more decent. But again, I do have an example of a man's shoe.
Okay, let's see. Oh, that's cool.
Again, that's a very good shoe.
Yes.
An example of a very good shoe.
Yes.
Again, the same features as the women's shoes. It's nice and rounded, so it's not narrow. Because what you find with men is that they like the very narrow shoes, the pointed ones. And what happens?
Sharpshooters.
Yeah. And what happens is that your toes get bunched up together that way. Now, that's not what your foot looks like. If that happens, you get toe deformities, you get corns. And a lot of men tend to get corns on their fifth, as women do.
Yes.
Yeah. So it has to be wide again, padded, rubber sole, laces to hold it in place. Because like if you have a moccasin type shoe, it's very good when it's new. But then after 2 weeks, it just becomes like a boat. You're floating around in it. But if you have the laces, you can always tie up the shoe and the shoe becomes tighter and it fits well. So good shoes, good fit, good back. Yeah.
Good shoes, good fit, good back. I absolutely love that. Your question should be coming in on 22232, which is our text line. With me in studio is podiatrist Sally Kariuki and Dr. Margaret Stower, who is a chiropractor, training us everything we need to know about our spine health and our feet health. We talked about alignment. Can we talk about misalignment?
Misalignment. When the spine is misaligned, you find that the person looks crooked. I have had people coming in like for lack of a better word, the center bolt is out. That is the pelvis. So they're walking in a kind of a wobbly way. So that means they're misaligned. And then pain is your biggest indicator of a misalignment. And it's very simple to correct. We all need to have good posture.
Yes.
Because it is our posture. I'm glad you're straightening up, my dear. Because it's our posture that causes misalignments. So we need to really make sure that we are always completely sitting up. You sit right at the back of the chair and make sure that your posture is quite correct. So misalignments do occur because of physical causes.
Okay.
Like you could have trauma.
Which is like an accident.
It's an accident,
Okay.
yes, which is like an accident. You can fall. You can have, which is like an accident.
Okay.
Okay, so physical forces getting into your spine and getting them out of alignment. Also chemical forces, because the body is very complex, and things that come and deal with you emotionally can cause you to hold yourself in a certain position such that you're misaligned. Because we're not just talking about the vertebra itself. The vertebra is connected with ligaments that connect one bone to the other.
Okay.
And that way, those are the ones that hold us in correct space. But if you have a little bit of misalignment, then you'll find the ligament pulls the vertebra out of position and you need to correct it. Should we go ahead with the correction?
Let's do it. Yeah, I'm very curious on what you do.
The correction is a high force, low amplitude force, where we just after palpation, let's say, for example, this is the lumbar, and these are the vertebrae that are kind of stacked up like a ton of bricks on each other.
Okay.
So if this is your low back and you have this is the natural curve. But sometimes because of pain, because of something you've done, the spine straightens up.
Okay.
So you've lost your natural curvature.
Yes.
So a chiropractor is trained to see which particular vertebra to push on it so that you can recreate that that misalignment.
So is it
it's
like
a very technical thing. It's not like and that's why I brought in my tool here, because one of my patients actually sent me a video which showed people hammering. But and she said, is that what they do? And I said, maybe that's the technique in India, but for us, we use a spring-loaded instrument like that.
Okay.
And you can place it exactly where you need the vertebra to move and just put a force on there.
Yeah.
So you really have to palpate. You can use your radiographic imaging, the x-rays, to see which one is out of position and then correct it. It's a low force, high amplitude, so it doesn't cause any injury to the spine per se.
Wow. I absolutely love that. And you can get the support you need from our doctors. Please do not wait until it's too much. If you're already going through any form of back, let's call it, can we say backache? Because many people say back pain.
Yes.
and they don't really attach it to the spine.
Yeah.
Is there anything
yeah.
like that though?
Yeah, backache, back pain is one and the same thing.
Yeah.
Because one of the things that we should mention is because not all backs are mechanical. There could be some infection going on in the spine.
Let's talk about
Yeah,
that.
yeah. An infection like tuberculosis, and the indicator is really high fever and general malaise. People are not feeling well. So you really have to make sure that the physician that you're going to see does a thorough examination on you and make sure that the diagnosis is correct before you're sent in to
get this,
to get
this
that
treatment.
treatment. So there are various issues about back pain. Back pain is so complex.
Absolutely.
Apart from mechanical causes, there are other causes that can cause backache.
Okay. Interesting question coming in here. What do our toenails, Sally, tell us about our foot health?
Right, toenails. If you look at people who take medications chronically, some of these medications tend to get like excreted in the nails. So if somebody has been sick for long and they have been taking a lot of medication, you may find a line across the nail, yeah? And if you calculate like how long that nail has been growing, you'll see at some point this patient was critically ill, or they were taking some very strong medication. As well, if you have nails that have grooves in them, you may find that the patient, or little holes in them, depressions, they have some autoimmune condition that they're fighting. You know, that can, and if the nails are clubbed and stuff like that, and you find that they probably have a heart condition, or, you know, the circulation is not good. If the nails fall off all the time, they are very thin. Again, you may find that the circulation is poor. So there's a lot going on in the nails. The nails can tell us quite a bit. Yeah? If a patient has gone through chemotherapy, the nails may turn black. Or if they have some liver condition, the nails may be yellow. Yeah, and things like that.
Okay, we'll be talking about shortly what good feet hygiene looks like. But can we learn more, just a little bit more, about the habits that affect our spine?
Habits. One of the first one that can be corrected is really what you're putting into your body. Really, one of the things is smoking. Smokers tend to dehydrate their discs, so smoking is an absolutely no-no. If you have to smoke, then of course you take more water, because body is 80% water.
Let's just
you
say
need to
no
hydrate.
smoking.
You need to hydrate yourself more if you're a smoker. But the good thing is because smoking has a lot of other issues that comes with it. The good thing is to stop smoking. Another thing that we tend to do, we are sitting too long. So the way we sit, the way we engage on our gadgets, you know, like the head forward, looking at the computer, the way you sit, you must make sure that your alignment, the desk and the chair are at 90 degrees. Make sure that your feet are on the floor. So it's just your habits, the way you do your stuff. Crossing the legs, you should cross at the ankle joint, not cross at the knees. Basically, it's really things that we can work with and we can correct. Normal back pain shouldn't be an issue here. We should be able to correct things and change the habits that we are involved in. Get enough sleep, because really stress and sleep, deal with your stress. Stress and sleep causes backache.
I love that you highlighted that. I think we should do it in class 1. When you get into school, you're taught how to sit properly on those school chairs, because that really doesn't happen. Or I missed the class. No, it doesn't happen for sure. So we need to train and learn. What are some of the recommendations you can make just now, since everyone is watching us and maybe they're slouching on their couch? What can they do right now?
Right now, they should sit back in the chair and make sure that they're not sinking. Their hips are not lower than their knees. Sometimes we sit on the sofa set and we are really like sunk down, because then it carves, instead of having your little nice C curve here, you've sunk down and you're really rounding out this way if you're seated. Remember, this is a tailbone. This is like where your seat muscles are. So instead of so you need to make sure that you're placing a cushion here and getting your curvature back. So if you have a cushion or a pillow or something you can place at the small of your back here, as you walk just, you'll be a little bit more straight. And you using the computer, using your your phones, use them up this way. Do not look down because it causes a lot of strain on the neck. This is an area where we have the vertebral column for the neck. Yep. And also the neck has got the C curve. Yeah. So if you're going to look down a lot, you're kind of going this way. You're slouching. And that would cause a lot of degeneration in the spine. Because you remember that this is a vertebra, and in between are bones stacked up on each other. So if they're rubbing against each other because of your positioning and because of your poor habits, you start aging faster because you're not doing the correct thing.
Okay.
So wear and tear in the vertebra because of poor habits, poor posture.
Okay.
It's all posture. It's all hydration.
I love that you've talked about what we put inside us. And each and every practitioner that has come in here, each and every person in this sector, they've talked about what we eat as a very important part of our general health. So it's not me who's saying, but you need to watch everything that goes into your mouth. And we might talk about a few things that you could start as good habits for yourself. Even as when we come back to you, Dr. Margaret, we'll be talking about sleeping posture. There's sleeping posture. Let's talk about that. But now, feet hygiene.
Right.
How do we take care of this beautiful gadget that we need?
Well, if you look at the feet, it's very easy, but because it's so easy, people tend not to do it. People don't think about their feet. The feet are farthest away from your body, so people don't even examine their feet.
Especially men, they have really ashy feet.
Yeah.
Am I speaking for anyone, please? Mafuta pia inapakwa hapa.
Because you get out of the bathroom and you wipe, your body from the knees up. You will cream them from the feet up. You will examine, but you'll never look at your feet until the day you start getting pain and you think, oh, okay, something is going on there. I best look at my feet. So good foot hygiene. What are we talking about? Something as simple as drying in between your toes.
Wow.
If you do not dry in between your toes, because your toes, most people's toes are very tightly packed together, so this moisture is retained, and you get athlete's foot fungus that is that grows in between your toes. And people are like, but I've had this for years, it's not a problem. But foot fungus can actually give you what we call cellulitis of the lower leg, which is an infection that travels up the leg, and it's very painful. The leg swells and bursts open, and you get wounds that can take years and years to heal. So it's a problem. So as simple as drying in between your feet after you've had a shower, that will help. And you find that it's not drying despite cleaning with a towel, then come see me and we'll help you. We advise you on how to get them dry.
Some people in sharks just putting salt in there, pack up salt.
But there are easy ways of doing it. So don't suffer alone at home. Then things like just moisturizing. Yeah, the older we get, the drier our skin gets. So if you don't moisturize, then it's very easy to start getting cracks from dryness. You get cracked heels and things like that. And infection again may set in, and then that's the beginning of a big problem. So moisturizing the feet is also very, very important. The other thing that we should also look at is the kind of shoes that we wear. And I have talked about that because shoes can cause a lot of problems. Shoes can be good, they can be bad, but you need to wear the correct footwear. If in doubt, contact somebody who knows a bit more about it, and they will guide you.
Consultation app or something like, should I buy these shoes, Daktari? This guy is selling this, there's a discount.
Yeah, no, it's important. And then the other thing is toenail cutting.
Okay.
Yeah, people don't pay attention to how they cut their toenails. You may be just sitting on the front of the telly and you're ripping them off. And then you cause an ingrown toenail, which can be quite bad. And you have to come in and we'll have to do a small operation to sort it out. But sometimes if you have a coexisting medical condition and you get an ingrown toenail, you can end up losing your foot. It can happen. It has happened before. So pay attention to how you cut your toenails. Yeah, it's quite a big problem. And then the other thing is things like smoking. And I know Dr. Margaret talked about smoking. Smoking is important because if you smoke a lot, it may interfere with the circulation. So you find that the circulation in your feet is reduced, and then this leads to wounds that don't heal, and then gangrene infection, and we have to cut off the leg.
Wow.
Yeah. So things, your healthcare, your general healthcare as well, your diet and things like this.
Absolutely.
Your weight do matter when it comes to foot hygiene. Foot hygiene is just not cleanliness.
No.
There are other things surrounding it as well.
Okay.
Yeah.
Wow. That's a great conversation. Today we have two beautiful ladies in studio talking about the health of our feet and the health of our spine. So for our podiatrist, we have that word, Sally Kariuki. Thank you so much for joining us. And our guest, Dr. Margaret Stower, who's a chiropractor. When we come back, our chiropractor will be telling us about the good sleeping positions. It's about time we go on a short break. We'll be back. 22232 is how you can text in all your questions, and then we'll be opening up the call line after a short conversation with them. This is Health Check. It's on Hope TV, where you look and live. My name is Carrie Kagiri. I hope you filed your taxes. You know, it's 30th June. Anyway, no pressure. It's up to you. Decide if you're going to do it. We'll be right back. Yes, we are back, and thank you for choosing Hope TV, where you look and live. My name is Carrie Kagiri, and you've missed a lot of great action, but thank God you can catch up on our YouTube channel that is on Hope TV KE. You can get to catch up with what we've been talking about. Today is all about the spine and feet health, and both of these are correlated, as our able practitioners have shared with us this evening. With us is our chiropractor, Dr. Margaret Stower. Thank you so much for joining us, and our podiatrist, Sally Kariuki. That other title, okay, fine, yeah, I was told not to use it, so I'll keep it like that. Sally Kariuki here to just let us know more about feet health. And when we went for the break, we were talking about good sleeping positions. Did you know that there are actually good sleeping positions? And Dr. Margaret will tell us more about that.
Good sleeping positions. You should sleep on your sides, either your right or your left side.
Mm-hmm.
Make sure there's a pillow in between your legs, yeah, and a comfortable pillow on your head.
So in between my legs, like here?
Yes, in
These
between.
are my legs.
So your legs are your feet are kind of flexed, and you're sleeping on your side. Yeah, and a pillow in between to take the pressure off the spine.
Wow.
That way you're actually recreating the curves, the natural curves when you're standing, such that when you sleep you also have the same curvature. So it's important to sleep on the sides, or you can sleep on your back. We absolutely say do not sleep on your tummy, because when you're sleeping on your stomach, the neck is turned to one side because of the breathing. You have to get air, so you're really straining your neck and putting a lot of pressure on the discs there and the neck. And sometimes when people wake up with a little neck pain just because of the sleeping posture.
Okay.
So absolutely try not to sleep on your tummy, sleep on your sides or your back. Pillow in between your knees when you're on your side, and your knees are kind of flexed so that the pressure is not off the back, and you're recreating the curvature of the spine when you're on your side. If you're sleeping on your back, put a pillow underneath your knees so that you're nicely rested. It's very important to get a good night's sleep. And if you're in a good position, your sleep will be comfortable, and when you wake up feeling very refreshed.
Wow. This is very interesting. I'm turning a couple of years tomorrow, and I've been sleeping wrong all my life. Sometimes it's just easier to fall asleep on your stomach. I don't know why. Someone told me that, and I just did it, and I actually disappeared, but I wake up on the side.
You wake up on the side.
Jesus speaks to me at night and turns me.
I know.
But yes,
yes,
you need to recreate that curvature.
You need to recreate the curvature. And the good thing about it is it's natural to us to turn and toes and as we sleep. So it's a natural format to turn. So we hardly stay static in one position. But if you're going to bed, try to sleep on your side first before you sleep on your tummy. Don't go down on your tummy.
Okay.
Yeah, because the first few hours of sleep is when you really are in deep sleep, and then you'll turn a little bit later.
Okay.
Okay. You need to change.
I've changed my ways, Daktari. I have changed. And you too. I hope you're listening and paying attention and telling a friend to tell a friend that Health Check is on. And this is a conversation we're having. Let's talk about flat feet. I remember how I learned about flat feet. I think we were in a swimming class. I was like, oh no, your mguu yako iko flat. We were like, mguu yako iko flat. We didn't know, like, it was really strange, like completely, like there's no that,
curve.
Yeah, and you're like, mine has a curve. That one doesn't have a curve. It was cool, it was weird, it was primary school. No one really told us about it in class. Please explain to us what really happens and what are some of the repercussions and how we can mediate them.
So now the first thing I must say is that Flat foot is not a disability.
No.
If you have a flat foot, you are not disabled.
Okay.
So please stop feeling like you have a disability.
You don't.
Okay. Flat foot is a foot type. Some people have high-arched feet. Some people have got just regular arches. Some people have got very flat feet. What happens, what brings about problems is if you put your flat foot in the wrong shoe. Yeah, and even if you have a high arched foot that people really like, and you put it in the wrong shoe, you will still get problems. Yeah, so it's about putting your foot into the correct shoes. That's why we have different type of shoes. So not all shoes are made for the same feet. You wear shoes according to your foot type. Do not buy shoes because they are green, blue, or they cost 1,000 shillings, or they are high or they are low. That is not how you buy shoes. You buy shoes according to your foot type. What is your foot type? Am I a pronator, spinator? These are just fancy words that mean high arch, low arch, And there should be guidance, actually, when you go and buy shoes. But unfortunately here, we just go to a shop and like, give me that one, give me that one, give me that one. No. But really, there should be some guidance.
Okay.
This is your foot type. Because if you go sometimes in the West and like in America a lot, the shop assistants there have a little bit of knowledge. They will help you. They'll tell, okay, your foot looks like this, go to that section. Your foot looks like this, that section, and stuff like that. Yeah. So if you have flat feet, you need a bit of support and things like that. So if you wear the wrong shoe for your flat foot, you will get problems, and which will lead even to back problems.
Wow.
Yeah. Okay. So when we say can flat feet cause back pain? Yes, they can if they're put in the wrong shoes. But flat feet are not a disability.
Okay.
So don't go to your doctor telling the doctor, I have a flat foot, I need a curve. No. You just need to learn how to live with your flat feet.
Wow.
Yeah?
And flat feet are beautiful.
Yes.
And they should get into the military. Maybe not go into that too personal. But even as we discuss that and we look at our different areas, as we've talked about correct sitting and we've talked about sleeping, can we talk about standing?
Correct standing positions. It depends a little bit on the foundation. I'll actually tell you that.
Okay.
Because as Sally, has said, what you're wearing would actually tilt your spine, and there's some people who have a very exaggerated curvature at the back, and it actually can cause a lot of pain. And you'll notice that when ladies are also expectant, their curvature is increased because the ligaments are very, very supple and they're lax, so they can actually increase that, and that will cause a lot of pain at the back just because of increased laxity in the ligaments. So can we talk about the foundation?
Please.
Okay. So when you're standing, make sure that your feet are slightly shoulder distant apart. Don't stand with your feet together this way. That way you don't get a good balance and a good posture. So make sure that your feet are a little bit apart, 6 inches or 8 inches apart. Same as your shoulder. So your shoulder width should be the same as your feet width. Okay. So you're standing with your feet this way, and you're kind of good posture. Yeah. It gives you a lot of confidence, and it's also good for your spine. Yeah. So standing posture is very important. One of the things that we do at the clinic is really check your posture and check how you should stand. One easy way to do it is stand against the wall and see whether your shoulders are actually touching the wall. If you go against the wall and your feet are apart and just go against a wall for yourself, check out and see whether your posture is good. Sometimes you'll find your shoulders a little bit off the wall. That means your posture is not right, and you need to correct it. You need to do some stretching, or you need to do some exercises, or you need to just correct yourself. Be conscious about your posture when you're standing. Yeah. Okay,
let's do that exercise. If you can right now with your family, you can stand up. Go ahead, stand on a wall and make sure that your shoulders
are against the wall.
It's touching the wall as well.
Yeah. Okay. And your small of your back.
Okay.
Your pelvis.
Yes.
Yeah.
Pelvic girdle.
But pelvic girdle is touching the wall. And if you can place your hands just underneath your back, there should be a small curve there. Okay. If there isn't, that means you're losing your natural curvature and you're flat onto the wall.
That's dangerous.
So not dangerous, but it can cause pain. It eventually would cause tightness in the tissues, tightness in the ligaments, and you'll have backache. Okay. Just because of that. So good posture is very important in standing, in sitting, and in sleeping as well.
There's a huge topic here that would take years to discuss, but let's break down heel pain.
Right, heel pain. Now, heel pain is very, very common. It's one of the most common problems that I see. Yeah, and one of the most common things that cause heel pain is, if I say plantar fasciitis or heel spurs, and what happens here is that we do have a ligament that, excuse me.
Finally.
We have a ligament that runs from the toes.
Do we have it? Just let's
to the heel.
Let's get it right on the camera, that particular one.
Yeah, we have a ligament that runs from the toes to the heel. And what happens, it's what's called the plantar fascia. And if it is overstretched, it tears away from the point where it enters the bone, the heel bone, which is around there, and you then get some severe pain, and especially like fasting in the morning or when you've been sitting for long and you stand up. This is a very common cause of heel pain. This is called plantar fasciitis, and sometimes it can cause a heel spur because as the bone is trying to heal itself there, it adds more bone, so you get a spur that grows that way. So heel spurs stroke plantar fasciitis is one of the biggest causes for heel pain. The other causes are fracture of the calcaneal bone, which is that one, where the patient may jump from a high surface and land on a hard surface, from high up onto a very hard surface, and that will crack the bone. And it's very excruciating. And the other thing is what we call shrinking of the fat pad. Your feet have a layer of fat to cushion them. It has to cushion the bones. And as we get older, or also some diseases like diabetes and stuff, will cause shrinking or hardening of that fatty pad. So what happens is that this bone is exposed to high pressures as you're walking, and that can cause a lot of heel pain. Then the other thing is obviously bad shoes. We cannot talk enough about bad shoes.
Yes, you need to get good shoes.
We talk about back and feet, shoes. So if you wear shoes that are not cushioned as well, you're walking for long distances on hard surfaces, you will get heel pain. And those are the most common causes. There are other causes, but these are the most common causes that you come across.
Absolutely. The phone line is now open. We're looking forward to answering your questions. I have paid consultation to our doctors. This is your time. Go ahead and make sure you ask all those questions. So the questions that are coming in on our text line 22232. Our call line number is right below the screen, so you can go ahead and give us a call. One is asking, hi Carrie, my wife has been experiencing pain and numbness at her right arm, and an x-ray shows that she has a minimal posterior slip of C5 and C6. Kindly advise.
C5 and C6 has slipped. As I said earlier, there are nerves that pass through the brain going right through the vertebra. So when it has slipped, it will press on the nerve that sends signals to her shoulder. That's why she's experiencing pain in the shoulder and the arm. What she needs to do is get, I'm sure she's done imaging, so she knows exactly what it is, and then get herself into a chiropractic office or a doctor's office and litigate that. She may need a few exercises to do, and she may need to correct her posture somewhat, and she may need a little bit of exercises to make sure that there is mobility within that vertebra that has slipped off.
So absolutely, you can visit Lavington, what did you say? Lavington?
Yeah, Lavington Mall.
At the mall.
On James Gishuru Road.
Yes. That's Lavington Green,
Lavington Green, sorry.
So
Lavington
please
Green.
visit Daktari, get to see her. And are you on social media? Maybe she can check it out. What's the clinic called?
Polycare Wellness Center.
Polycare Wellness Center. So go
Info
ahead.
PCC at
You'll give her a few exercises?
Yes.
It'll come back.
Yeah, she will. We will, and it's important to know what her age is and what else, what symptoms.
If you could share more details.
If she could share more details. Yes.
Awesome. Free consultation. It's not free, I've paid. Let's talk about one here who is talking about flat feet. I ruffled a feather. Fatma is saying, I was disqualified from the army for having flat feet. What about it? Fatma from Rongai. But anyway, we had talked about this during the break, and maybe you can just highlight for her what she needs to do also just to keep herself healthy.
No, as we said earlier, flat feet is not a disease.
It's not a disease.
So as long as she puts her feet in correct shoes, and this is supportive footwear, shoes that are not flat, shoes that have that will give her a curve, a support on the arch, then she shouldn't have any problems. She'll live a normal life. She may not wear the most, like the fanciest shoes like she wants to wear, but she'll live a normal life with no pain. And as far as the army question is concerned, I think we'll take it up with the government.
Serikali, tafadhali. One Alex is asking, good evening. Thank you for watching, Alex. Asking, good evening. How do chiropractors differ from osteopathic practitioners, and are you involved in holistic medicine?
Yes, we are involved in holistic medicine at the Polycare Wellness Center. Chiropractors and osteopaths are very similar. In America, we call them chiropractors. In Britain, they're called osteopaths. So it just depends on where they graduated from.
Okay.
So that's one of the differences. The second difference is osteopaths tend to prescribe lots of painkillers or medication towards the patient, while chiropractors are right into let the body heal itself, let's correct the misalignment and advice. So the approach may differ a little bit, but it's very similar in training, depending on where you're trained. In the UK, you'll be called an osteopath. In the US, in Australia, in Canada, you'll be called chiropractors. So that's the major difference between chiropractors and osteopaths.
Absolutely.
But they all deal with the musculoskeletal system of the body.
Okay. Thanks for describing that to our viewer. Our call line is definitely open. You can call in and ask all the questions. Also, you can go ahead and text us on 22232, which is a text line. One was asking, we talked about this earlier, but we can just go back into it. Sleeping postures that bring back pains. Do we really need pillows?
Yeah, I know. I've said this once and I'll say it again. Pillows have been overrated.
Yes.
For lack of a better word.
Yes.
The best pillow is to know that people have different necks. Some have tall necks like Kerry here, some have shorter necks. So you need to really check and see that the pillow that you're using is the same distance from your earlobe to your shoulder. So look at the pillow, see whether it's the same distance from the earlobe to the shoulder. And if you're able to do without a pillow, all the better. Because pillows have been gimmicked. People are making a lot of money of selling very expensive pillows. Get something that supports your shoulders as well as your head, so that you're in a nice curve.
Okay, let's get to a call, but we're coming back to that because I really need to understand that better. Ruth, good evening.
Good evening.
Thank you for calling, Ruth. What is your question?
Swali yangu ni kuwa na shida ya
shida ya wapi?
Mgongo.
Yes.
Sasa wakati nilienda x-ray wakaniambia ni muscles imeumia. Sasa nikaanza matibabu. Sasa nikamaliza dawa. Sasa
Sorry, Ruth, utarudia kidogo. Ulisema wakakwambia ni shida ya muscles alafu
matibabu nikaanza kunywa na dawa. Hiyo ni mwezi wa 6 last year. Sasa nikapewa dawa mara 2. Sasa nikaambiwa niende huko exercise. Hello. Sasa bado niko na uchungu sasa nikiinama kidogo ni uchungu sana. Nakuwa na uchungu sana mpaka sehemu ya chini kote mpaka tumbo ya mbele ninasikianga uchungu sana.
Okay, we didn't get everything clear. Unasikia uchungu ukifanya nini na nini? Daktari, do you have any follow-up question?
Nikiinama, kazi yangu ni ya kuinama. Sasa nikiinama kidogo hivi ninasikia uchungu kabisa, mgongo ya chini na tumbo ya mbele. Inani-affect mpaka miguu.
Okay. Do you have a follow-up question?
No.
That's okay. Okay, thank you so much, Ruth. Tutakujibu sasa hivi. Thank you for calling and watching. Wow.
Tunamjibu.
Yes, go ahead. Yeah.
All right, okay.
She's watching.
Ruth. Ruth, ukiwa na shida ya mgongo, umesema una shida ukiunua kitu, si ndio?
Yeah, which is bending.
Alafu unasikia shida, unasikia uchungu wa mbele
na her feet as well, her legs.
Na mgongo na feet.
Yeah.
My Swahili.
No, it's okay. You just answer in English. It's okay.
Ameniweza.
National language.
Sasa ni vile mgongo iko na miswali. Ni miswali, si ndio? Nerves.
Okay.
Miswali. Hizi zinatoka nyuma, zinaingia mbele pia. Kwa hivyo ukiwa na shida ya mgongo, utasikia pia huko mbele ina uchungu.
Okay.
Na tunaambia watu wasije kuinama sana na kubeba mizigo kwa sababu hiyo inachukua inaweka uzito kwa mgongo.
Yes.
Na vile walisema muscles, umekunywa dawa lakini haisaidii, ni vile muscles ziko tight, unatakana pia ufanye mazoezi.
Yes.
Uangalie hiyo mgongo iwe loose.
Okay, absolutely. So kuna mazoezi and it was really good. I didn't even know what nerves are called. But let's pick this call. Sheila. Sheila from Kisii. Thank you for watching. Sheila.
Okay.
Uko na swali gani? You can go ahead and ask your question.
Yeah?
Go ahead and ask your question, Sheila. Thank you for watching.
Hello?
Hello, tunakusikia. Karibu sana Health Check.
Okay, nilikuwa na shida ya mgongo for almost 6 years. Ilianza after the second delivery. Alafu sasa nimeenda hadi MRI, nimefanyiwa x-ray. They are saying that ni nerve compression, muscle spasm. Sasa ina extend to mguu. Sasa nimetumia dawa, imekataa kabisa. Sasa sielewi.
Wow. Do you have a follow-up? Any of you? She even her feet.
Ako wapi?
She's in Kisii.
Ako in Kisii, okay.
Yeah.
Okay. Anafanya kazi gani?
What work do you do, Sheila?
Okay, ni kazi za nyumba tu.
Kazi nyumba, okay.
Okay.
Yeah.
Okay.
Na back pain inauma kabisa, alafu ina extend to the right leg. Anakaa kama na limp.
Okay.
Wow.
Okay.
Yeah. Almost 6 years.
After your second delivery?
Yeah?
After your second delivery?
Yeah, after second delivery ndio ikaanza tu hiyo shida, mgongo inauma alafu ina extend to the right limb.
Okay, we'll be responding to you right now. Thank you very much, Sheila. And after that, we have Hilda. Can we pick Hilda as well? And let's listen. Hilda, thank you for calling. Yes, go ahead.
Yeah, I've suffered neck pain. So this is the 3rd year now. So my MRI says it's cervical spondylosis. I saw a neurologist who says pinch disc. There's a pinch nerve, and the next is that the discs are a bit degenerative disc disease in the neck. I've done physios, I've done exercises, your neck. I've seen many doctors. This thing is not resolving. Yeah, I've really suffered. The pain can't let me do anything much. So I was just wondering if you could advise me on how best this pain can be managed. Medication is not helping. I've been put on muscle relaxants, antidepressants. Yeah.
Okay. But stay encouraged. It's gonna be bright soon.
Hello?
Yes, stay encouraged.
Ask her whether she has any headaches.
Do you have any headaches?
Yeah, the pain actually, I have pain at the back of my head. And the pain radiates up to the... Yes, I do.
Okay, reduce the volume of your TV, please. Okay, yes, but she does, yeah. Okay, thank you.
Her name?
Hilda. But also, let me just advise, thank you, even as you continue to call us live in studio, reduce the volume of your TV to reduce the echo so that we can hear you faster and respond even much faster. And Dr. Sally, you're also welcome to respond. Sally Kariuki, you can go ahead. Yeah.
Okay, Hilda, I need to start by answering your question.
Yes.
Through the various things you've done. You've seen a neurologist.
Yes.
They've established what you have. You've done imaging. It shows what you have. And they did tell you that degeneration of the vertebra. Unfortunately, degeneration gets worse with each coming year, but we can kind of slow down the degeneration by mitigating by exercises, which you said you went to the physical therapist and you got some treatment, but it hasn't helped. What you need to know is, have you been consistent with your therapy? is there something that you're doing that is not making it better? And as I said, cervical spondylosis is an ongoing condition which we normally get because of what we used to do. There are certain things that people do, like if you've been carrying loads on your head, that causes a lot of pressure on the vertebra and makes them wear off while you're younger. So when you're older, that's the things that we deal with when we are older because of the degeneration in the vertebra. But having said that, I'm thinking that probably what happened is you are not consistent with the program that was given, and you may want to keep going to the physical therapist. If you can't do, if it doesn't help anymore, check out the chiropractors. There is no chiropractor in Kisii. I think the nearest one you can get would be, when the lockdown goes, I mean, you can come into Nairobi. We are 13 chiropractors.
Hilda is actually in Nairobi.
There is?
I think Hilda is actually in Nairobi.
Oh, she's in Nairobi?
Yeah.
Okay. Depending on where she is. We are 13 chiropractors in this country. Mm-hmm. There's one located in town. There's one located in Nyanyuki. Mm-hmm. There's one located and various parts of Nairobi. What you have to do is go on our website, which is Chiropractic Association of Kenya, and see who is nearer to you, and we can be able to help. The thing between chiropractic and physical therapists, chiropractics are very good on chronic pain because this has been going on for 3 years and plus. Let them examine you. Let's see which way we can litigate. I'm sure the headaches can go, and there's other aspects that may be able to be helped with chiropractic. Physical therapy is good because it strengthens the ligaments and the muscles around that area, but you need to get into a chiropractor to see which way we could go with it.
Thank you so much. Sally Kariuki, a question for you here. I'm Liz. My left leg swells at the ankle during menstruation. What could be the problem?
Right, now when we come to edema, which is the medical term for swelling, if it's localized to one side, then we need to look for like a local problem, that sort of thing. So swelling can be a lot of things. I will not like relate it to menstruation per se, because then if it's menstruation, it tends to affect the whole, it will affect both legs, things like that. So there must be something else that is going on. And I don't know if she's seen a doctor and what tests she's had and what she's been told. What I would say is see a physician, or if you're not able to see a physician, you can come and see me or another podiatrist, so that we can then do our examinations, ask the relevant questions, and we come up with what is going on.
See our podiatrist. See her.
Because I can't really make a diagnosis on just that.
Come in. Again, one more time. We said this when we started the show. Maybe you just joined us. It's very important for you to go see your doctor. It doesn't mean you have to have an issue ongoing. If you, just go for a general checkup, check if are my legs okay, advice, what shoes should I wear, I'm feeling this way. Go as soon as you can, and not when the issue gets completely degenerated, and that's really hard. We got a response from the person that texted in with the issue of the numbness of the right arm, and they said she's 38 years, currently lactating a 1-year-old, and challenge began 2 months after delivery, but the imaging was done last month.
Right. And I'm thinking it's more the posture that she's holding her baby on.
It could also be that.
It could also be that.
Wow.
It's really about posture and what we're doing, particularly when you're younger. Before the degeneration sets in, you really need to get yourself checked. I think it's more posture and the pressure that she's applying onto that. Because the numbness could be either due to tightness in the muscles, because the nerves run interposingly in the muscles. So depending on how she's lactating and she's nursing her baby, it could be just because of posture. It could be all kind of things. So it's helpful. It's something that she can get corrected within no time.
Absolutely. You get all the support you need. Even as we do that, can we talk about lifting heavy things without harming our back? And we can start with our feet, because our feet do a part in lifting things. You said the whole skeletal muscle is connected.
Yes.
How do we start, and then we go now to the back? Let's start from the bottom.
When it comes to lifting heavy objects, you want to distribute your weight evenly. What you'll find is a lot of people, I don't know, sorry, because I'll step on your toes a bit, because I won't be able to talk without talking about the back. Huh?
Yeah,
So
okay, sure.
that's fine. Yeah, a lot of people just bend, you know.
Yes.
Oops, sorry.
Yes, it's okay.
A lot of people just bend, and what happens is they then put pressure on their back. Huh? So as far as the feet are concerned, what we say in the legs is bend your knees and put your feet flat on the ground. Do not tiptoe as you're going to bend. Put your feet flat, bend your knees, and then
Okay.
And then approach yes. You need to bend your knees and make sure that your spine is correct and bring the object closer to you. So you're not bending forward, but you're bringing it over closer.
Okay.
But the whole concept of the pressure of getting off from the back, it will be transmitted to your leg muscles, so that your leg muscles are the ones that are helping you to lift heavy without harming your back.
Yes.
Yeah.
Absolutely.
And if possible, get someone to assist you. There are people who lift, and this is a true story. There's someone who came in with a back pain because he lifted an engine, a car engine, and I was asking,
Why did you lift
a car engine by yourself? Of course, men are men.
It's macho.
So yeah, there's a criteria. You should
Absolutely.
not lift twice your weight. So you
I
don't
met
lift anything heavier,
Uh-huh.
double your weight.
Met a lady who serves in the cabin crew. And when someone tells her, they like the hand luggage to put it up for her, she's like,
Yes.
you packed it.
Yes, can you lift it?
Lift it.
Exactly.
Because she, and she does it very politely, but you're like, you're here to serve me, but no. She's like,
Yeah,
you packed it?
Yeah,
Lift it.
and that's why there are actually criteria on how much weight you should be able to pack in your luggage.
Absolutely.
It's because you're responsible for transporting it and you don't want to hurt your bag.
Okay.
Even then, I think the 70-kilo bags they were previously 90 kilos. They were reduced because of people trying to lift and throwing heavy gunny bags of cereals here and there. So really, that was a good thing. And the National Health, Occupational Health Department actually cut down the weight that we should to lift.
And that is something very important that you said about the weights, because one thing that I find, which maybe it's an issue you should really address, is when people go to the gym and they're doing squats,
to do that.
And they're being asked to lift, this is your weight, so you should lift this. And so it's almost impossible, and people then do come in with back injuries.
Right.
Absolutely.
What would you
because
advise
of
on
lifting
this?
very heavy.
Absolutely.
Yes,
Before you comment on that, let me pick the first male to call us, and then you'll respond to that. Don't lose the train of thought. Patrick in Nyahururu. Patrick, good evening.
Yes, good evening.
Yes, go ahead with your question, sir.
So I have a question. Hello.
Yes, we can hear you. Go ahead.
Can you hear me?
Yes, sir.
So I've been suffering from back pain from last year on December. So I've been going to the doctor. He's telling me about rheumatism. Hello.
Yes, sir. We can hear you. Continue.
But I have not been understanding very well because when I bend my body, I have been feeling some pain going to the leg.
Yes.
And more so when I'm doing some exercise. So how can I get being assisted?
Awesome. Do you have a follow-up question for him?
Can you repeat it for me, please?
Oh, okay, fine. So he has back pain. He's been told it's something to do with rheumatism.
Okay.
And he's having pain when he's doing exercises. His leg is also starting to hurt. And it's since last year, Patrick? Oh, okay, great. Oh, yes. So that's his issue. So he went to the doctor and was told something to do with rheumatism. And he's still having pain on his leg now, and especially when he's exercising. Yes. And so you'll pick it up also with the exercise comment.
Yes. Back pain with rheumatism could be the issue, because really, as we said, back pain is very complex. It could be so many causes. But what I think, and I'm thinking that because it started with back pain and it went into the leg, it is more mechanical. There's a lot of pressure on the back, so the disc is being compressed, and it's compressing that big nerve that we call the sciatica, which gets its roots from L4, L5, meaning the fourth and the fifth vertebra. This is a sciatica nerve. And if there's compression here, then of course it's pressing on the nerve. So I'd advise him to really get a correct diagnosis.
Yes.
If it's due to rheumatism, he might want to see a rheumatic doctor, and get medication for that, and that would relieve it. But having said that, he needs to be careful about the things that he does, because you could be exercising wrongly. Yes. Lifting up heavy loads, like if you're going to the gym and lifting up something which is too heavy for you, you might be straining and spraining your muscles. And sometimes you can actually get a tear of the tissues. You can tear your ligaments, and you can tear also the muscles because of too much of heavy weight lifting. So people should be careful about how much weight they lift, and gradually go into gradual. So if you're lifting up like 30 kgs or 20 kgs at the gym, gradually work into it. Don't go from 0 to up. Let the body get conditioned in order to get that particular weight that you lift. And make sure you know what maximum weight you can lift. And it all depends on that body type. There are some people who are short and stout and can lift heavier, and there are body forms that are tall and may not be able to lift without injuring themselves. So it depends on your body type, it depends on what structure you have, and we cannot say this is how much you should lift without seeing you physically and knowing what your weight and your structure looks like. But for him, he needs to have a check with his doctor. If there's rheumatism, he needs to have medication on rheumatism. But having said that, he needs to look at his mechanical, the way he's doing his exercises.
Okay, James from Kitui has a question about what? Hyperlordosis, the treatment of hyperlordosis. And who is that, or what is it?
That's very good. Thank you so much, James. James from Kitui.
Yes.
Hyperlordosis.
Hyperlordosis.
Yes, very nice. That's a very good question, James, because we always talk of lordosis and we talk of loss of lordosis, which is hypo. But if it's hyper, it means you have more of the increased curvature. Remember I said it should be a C? And then there's a lost one, which is a straight, and now him is extreme.
A U.
That one, yes, like a U. You could say U, that one would cause pain. And particularly more in the front of them, of the muscles. Now, there are specific exercises. As we said, we are a wellness area, but it's specific exercises that could litigate that. Maybe he needs more strengthening to strengthen other areas, and more flexibility to stretch the tight tissues. So he really needs to come in and get examined by a doctor or a chiropractor or a physical therapist and get to see what works for him, because there is also hyper. So there's an increased curve and there's also a less curve. The most common one is less curve, because most people really lose that normal curvature. But then the least common one is the hyper.
Absolutely.
The U curve.
Okay, the U curve. Yeah, I just came up with that. Someone
That's a good one.
Pay me. Anyway, we're about to wrap up the show, and as you prepare what your closing remarks are, let me just throw a couple of more questions that have come in on 22232, and that's how do fibroids and back pain relate? And finally, some of the practices we can do to loosen our back pain. That's Stevenson Babajona is asking.
Stevenson Babajona?
He said it's Babajona.
That's nice, because this is a Baba asking about fibroids. Fibroids really are in the structure of the uterus, which is connected to the back. So, as I said, there's so many causes of back pain. We need to know why and what is causing back pain. It's not just a mechanical issue, it also be something pathological. So if the fibroids that's in the uterus, that would actually mean, okay, should we have those fibroids removed? Should we have the uterus removed? And those are questions that the patient makes independently with the help of the doctor, and that will relieve the back pain. And some people can actually have kidney issues that can cause back pain. So we really need to make sure that we get analyzed properly, get diagnosed, get imaging before you go in and see, okay, this is what it is. And that's why the chiropractors or podiatrists are all trained to make sure that when we get to see our patients, we know exactly what we're doing. We spend quite a number of time learning about the structure, the physiology, the anatomy, and the pathology that goes with all this. And The other question was
loosen back spine. The back spine.
To loosen
yes.
the back spine. Exercises will loosen actually your tightness in the tissues.
Okay.
One of the easiest things to do is really just get into an activity that we enjoy doing. And I always tell people, you don't have to go to the gym. There's some stretches that you can do in the house that can help. And walking is a good exercise.
Absolutely.
That people can engage in to make mobility in the spine. The body was created for motion rather than static.
Absolutely. Absolutely. Thank you. As we wrap this up, we'll start with you, Sally Kariuki. What would you tell our viewer this day? What is that one thing that you need to tell them to completely work on in terms of their feet health?
When it comes to feet, takeaway message is just take care of your feet and seek medical attention early. Do preventative foot care, because by the time you start getting pain in the feet, it's been going on for a while.
Yes.
There's something there that has been going on for quite. Foot pain is mostly, unless it's an injury, is mostly cumulative. So it's been happening for a long time. So really take your foot health very seriously.
My doctor says as he's walking up the stairs, his knees are always in pain, they're crackling. Is that part of your specialty?
Yes, we deal with knees as well.
Okay, so does he need to come and see you?
He can come and see me,
yes.
Yes, I'll be happy to sort him out.
Dr. Sally is ready to sort you out, and Sally Kariuki is ready to sort you out and take care of your knees as they are cracking as you're going upstairs. Yeah, and also do exercises. She said that. As we wrap up with you, Dr. Margaret, what would you advise our viewer this day about our spine health?
Viewers, you only have one spine in the body. You can replace a knee, you can replace a hip, you can replace a shoulder.
Can you replace this part?
You cannot.
No, okay.
You cannot replace. You can play up prosthesis. You cannot replace. You cannot replace your spine. So it's important to look after your spinal health. Drink plenty of water, exercise, good nutrition, take regular walks, and don't wait for pain before you come in to see your chiropractor or your spine doctors. Go in and see them just to get an evaluation. There are people who are born with certain curvatures that are, congenital, like scoliosis, which when a child is born with a curvature that is on your right or your left. This can be litigated when they come in young enough. So don't wait until things get too chronic. Come in early and let's look after you.
Absolutely. We've been learning a lot about this. And just one more time, someone is asking, Daktari, where are you practicing? Please share, both of you, where it is you can be found for anyone who'd love to visit.
I am in Paresia Center, that's on Gong Road, opposite Uchumi Hyper, next to Good Shepherd Church.
Yes. It's very clear. It's normally written there, Paresia. So you can't miss it. And for you?
Lavington Green Shopping Center. We are on James Gishuru Road. And then we are off Ngecha Road at Bishopsgate, Nyari South.
Absolutely. Is that through the new bypass?
Yes, on the new bypass.
To Red Hill.
To Red Hill,
then
just there. You'll see
us.
Our clinic is called Polycare Wellness Center.
Absolutely. Thank you so much for watching Health Check. I'd like to encourage you to share this video. This is knowledge that many people need to get to. I mean, we can't go into all the exact details and we can't answer all your questions. However, would love to. So go ahead, interact with our doctors. They are available for you. They're here to serve you and your health. Remember, one thing that has been mentioned, what you eat is very important, and how you take care of yourself. And my highlight for feet health, take care of your feet, man. No more ashy feet from today. Is that deal? I'll see you next month, because that's when the next episode is. Next week on Tuesday. We do this every week right here on Hope TV, where you look and live. My name is Sally Kariuki. Have a good night. Thank you one more time for coming, ladies.
You're welcome.
You.
Yeah, let's go home.
Thank you for having us. Thank you.
Absolutely.